Hi, everyone. I'm Dr. Laurie McCauley, and in this discussion, I'm going to be talking about neurodiversity in a neurotypical world. I decided to educate people in the veterinary field about this topic because at age 55, I found out that I was autistic. And that was like a major crusher for me. And it was helpful because I also found out I was in the 98th percentile for intelligence for women my age. So that helped a little bit. But because I'm autistic, I hyper focused and learned everything I could and realized a large percentage of people in the veterinary field are neurodiverse. And once we understand a lot about being diverse and how our brains work, our lives become a lot better. And though I've never been suicidal, I have more than I can count on one hand friends that have been there. And I want to help everyone I can never be in that place. So let's talk about neurodiversity. It's a non-medical term. It wasn't even coined until 1998. And it's not a disease or it's something that's wrong, in my humble opinion. It describes people whose brains work differently than neurotypical people. So we all think, we all learn, we all process, we all behave. Neurodiverse people just do it a little bit differently. We have different strengths and struggles, but we all have strengths and struggles. So if we know what ours are, we can learn how to best use them. And it can be ours, or it can be the people we work with, or people in our family. By understanding this information, we can have a much more calm, relaxed life, both at work and at home. So neurodiversity can also be a comorbidity to other things. And I want you to learn about that because if you are neurodiverse, you need to know to look for these things. In this talk, I'm going to be focusing on high functioning neurodiversity. So not the people who can't speak or who need help to live, but the people that we work with and people in our family who are just a little different. I like to consider myself neurospicy. So what is it? Not a disease. For the high functioning people, not anything that we need to cure. And there was a study looking at 11 Yale math Olympiads. So the highest of the high, brilliant intelligence, 7 of the 11 scored autistic, right? So we can understand that you can be both brilliant and neurodiverse. When or if you find that yourself or someone you care about is neurodiverse, sometimes medications can be helpful. I'm not going to talk about that, not my job, but therapy, I think therapy can be helpful for everyone. In the general population, there's about 20% of people in the world that are neurodiverse. In my opinion, I think in the veterinary profession, it's much higher. And let me tell you why. I gave this lecture for a keynote speech for the American Holistic Veterinary Medical Association. And I thought, this is really vulnerable coming out and saying, I am autistic and I'm neurodiverse. Yet, when I put up the slide, and you'll see it in a little bit, that says, if you think you or someone you care about is ADHD, here's a bunch of tests they can do online. I would say at least 80% of the people in the room picked up their camera and took a picture of that. And I went, oh, I'm right. These people, either themselves or people they work with or people in their family or someone they care about is neurodiverse. And learning about this is super, super important. So what's included in neurodiversity? Well, there's ADHD, 4 to 5% of adults. And we're going to talk a lot more about this one, but just to give you a quick description of each of these. So 4 to 5% of adults, you may be restless, you may have trouble concentrating. A big thing here is acting on impulse. And we're going to talk about how we can work with that. There's dyspraxia, 6 to 10% of adults. They have difficulty planning their actions. So I know what I want, I just don't know how to get there. There's dyslexia. People are, that's a real common one, 10 to 15%. People that have problems accurately and fluently saying what they want to say or have trouble reading or spelling. There's alexithymia, which is the inability to identify and verbalize your feelings. right? It's 10% in the general population. 50 to 80% of autistic people can't identify how they're feeling, right? Autistic spectrum disorder, 1 to 2%, challenges with social communication, restricted interests, repetitive behavior. Again, we're going to talk a lot more about that one because I'm really familiar with it. There's dyscalculia, so problems with math. So think about the people who like, okay, I need a drug dose for this size dog in with this milligrams per ml, and they just can't get it. It just doesn't work in their brain. That's dyscalculia. There's dysgraphia. People have trouble writing down what they're feeling or thinking or saying. There's bipolar, people who can be talking to you and be fine and then be manic and crazy or really depressed and they have swings. We're not covering that one, but it's one to recognize and realize there's things we can do to help them. There's OCD, and I have friends that are OCD, right? Some of our friends are. They make great people for like keeping things clean and organized because everything has to be like this. And sometimes they drive you crazy because everything has to be like this. And what you need to know is the reason everything has to be like this is because if it's not, their anxiety goes up. So if you get in their face and say, "What are you doing?" Right? All that does is drive their anxiety. If instead you work with these people and say, "Hey, I see you're struggling with this. Let's take a step back and see how to fix it." That brings their anxiety down and allows them to come from a more calm place to help them get through life and figure out what they're doing and how to do it. So again, if you have somebody that's OCD, realize they are the way they are to decrease their anxiety. All right. If you haven't guessed, there's a lot of crossover. If you're interested in learning more about the crossover, this is a great website to go to. And I love this visual of how we can be a lot of things. And it's not just negative things. There's a lot of really good things in here, right? Authenticity, hyperfocus, resilience, honesty. That comes with being neurodiverse. Not that neurotypical people can't be that, but this is some of our special gifts. Another reason I want to talk about it is because I do think a lot of people in the veterinary world are neurodiverse. And when we learn about it and learn not just about the negative part, but about the positive part, it helps us soothe our mind. We know what to look for. We can be more mindful of what is coming out of our mouth and thoughts in our head and our actions so that we can be who we are and be proud of it and use our gifts to the best of our ability. In the world, they estimate a low estimate of 78 million people. I want people in the veterinary world to adapt and succeed, to learn that they're not sick or defective, that their brain is just wired a different way. And once they realize that they do have gifts, that helps them be happier. One of the big gifts that we have as a neurodiverse person is extraordinary persistence and resilience. When people tell us, no, you can't, it's not, no, I can't. It's, I'm going to show you that I can and I will, and I am going to think outside the box and do it my way. So first one I'm going to talk about is ADHD. We're going to cover ADHD and autism in a lot more detail. So if you think you have ADHD, here's some of the things to look for. You may have trouble managing your emotions, thoughts, and actions, right? We talked about impulsivity. You may be hyperactive, and that's not a bad thing, right? Hey, go for a run. Be comfortable in your own skin. Hike, swim, do something that helps you be you. And that will help you by doing that, come into yourself so that you can pay attention, control your overactivity, help you regulate your mood, right? If you're like, I am really upset about something and I go for a hike and I come back and I'm like, hey, I can handle this. That's good. Recognizing that and being able to know when you need to do that is extremely helpful. It helps you stay organized, concentrate, follow directions. And I recommend if you are ADHD, learn how to just sit still, even if it's for 60 seconds in the beginning, and just breathe. And then you can get up and jump and dance around. People who are ADHD struggle with starting something. I want this, but I don't know how to get it, so I'm not going to do anything about it. Or they get into it, and they may be both, and they get almost done and they can't finish it, right? if we see that in somebody, we can help them. Hey, how can I help you so that we can complete this task and have you be so overwhelmed? Because these people are overwhelmed. They're not lazy. They're not just procrastinating. It's not a choice. It's how their brain works, and we can help them, right? How many of you would want a friend that would come and say, hey, listen, I see you're struggling with this. Let me help you because I can help you get through these if you're willing to work with me. And then we'll get it done. And then you'll feel that sense of accomplishment and you can take that next step faster and easier next time. And you say, yeah, Laurie, right. Honestly, it's the anterior cingulate cortex in your brain that is very fast at changing. And every time that you resist an impulse, it gets stronger. And every time you give in to an impulse, it gets weaker. So you can make small changes that actually change your brain to help you be less impulsive and be able to think things through better, or do things like, I'm overwhelmed, I can't do anything. Let me just do a little bit, and then I can do more, like chunking. Comorbidities. To me, this is super, super important. If you are ADHD, you want to look for these things, find them if you have them. Don't manifest them, just find them if you have them, or be aware of that they could be there, and then work with them. So depression, substance abuse, general anxiety, social phobias, other phobias, panic disorders, bipolar, dysthymia, so mild depression, obsessive compulsive disorder, intermittent explosive disorders, eating disorders, hypertension, type 2 diabetes, obesity, asthma, and migraines. Why is it so important? Because if you're ADHD, not only are you more likely to have these, you're likely to have it more early in life, increased severity, prolonged duration. The last thing we need is longer migraines, increased complications, chronicity, and you're more likely to relapse. So again, if you see these things, look out for these things and be aware and take steps early so that they don't become something bigger. Some of the ADHD greats, Michael Phelps, right? He took his extra energy and put it into swimming. How many gold medals can this boy win? Adam Levine, Howie Mandel, Justin Timberlake, Jim Carrey, Bill Gates, and one of my favorites, Walt Disney. ADHD people have superpowers. They can hyperfocus. They're resilient. They have extreme creativity. They're much better than me at conversational skills. Blasts of spontaneity, abundant energy and exuberance, and they're emotionally sensitive and they have empathy for others. Come on, think about that. Wouldn't that be great to have somebody in your hospital that could be hyper-focused, resilient, creative, talk to people well, be exuberant, full of energy, spontaneous, and have empathy with others? It's perfect. We have to realize that they have a unique perspective. They think about things differently. And so that we can join with them to think things through to find solutions to problems. Another really thing that's very cool is that their brain thinks fast, really fast. So if you have an ADHD person speaking to an ADHD person, and I have this in my life, they can speak in half sentences and know what each other's thinking. And why do they speak in half sentences? Because their brain is thinking faster than their mouth can speak. So they're already on to the next topic when you're stuck listening to them, hearing them going, okay, what's the rest of that? So I can follow the directions you're giving. And ADHD people can talk to ADHD people better or more clearly than if they're talking to neurotypical people. And my challenge is I'm autistic. So there's even more disconnect there. So my wife is ADHD and I am autistic. So we have to work very hard at our communication skills. What's another thing that's really cool with ADHD people is a higher percentage of them can actually see things if they close their eyes in 3D. So some people close their eyes and they can't see anything. Some people can see images. And if you have ADHD, you're more likely to be able to like turn things around and move them around and see them in 3D, which I think is super, super cool. For you, if you're like, I don't know if I'm ADHD, think about this. If someone is coming to talk to you very slowly and it drives you crazy and you're like, just spit it out, you may be ADHD because your brain is going so much faster. You're like, I can't think things that slowly. If you don't finish your sentences, and you expect people to understand what you were thinking rather than what you were saying, you may be ADHD. If you have a child that is, you think, oh my gosh, they have so much energy, they have to be ADHD. If a child is ADHD, there's a 40% chance that either one or both parents are ADHD. So how do you get through life? Find other people to talk to that can talk on your level. That will relieve your brain so much because you're not like, I said it to you. No, you didn't. I did this. You didn't finish it. You are with somebody who understands you and can compliment you and talk to you. They get you. And that's really helpful. Why is that helpful? Because if you're constantly around people who have trouble that you have trouble communicating with, or they have trouble communicating with you, you will lose your self-confidence. You will maybe feel depressed and shame, and it's not you, right? It's that when you're with somebody who thinks like you understand each other and your confidence grows and your self-esteem grows. And it doesn't mean like, oh, well, I can't work because nobody else thinks the way I do. It just means you spend time outside of work with the people who understand you better. Find creative outlets who allow you to be you, and that will help you feel so much better about yourself. So here's the magic slide. If you're ADHD or think you might be ADHD or someone you work with or care about is, take a look at these places. Now, it's not a definite diagnosis. You want to talk to a medical professional for that, but it's a place to get started. Autism, 1 to 2% of adults in the US, and we know that women are significantly underdiagnosed. So in women, autism shows up with different clinical signs than with men. And that's been seen a lot, it has been studied a lot in children, but it's the same in adults. We just see it differently, and I'll explain it to you a little bit more in a second. So things to think about. People who are autistic have exceptional attention to detail, right? We see the tiny little things as well as the big picture. We have excellent pattern recognition, excellent problem-solving skills. So when we are surrounded by or given a problem, our brains work really well at figuring out how to fix it. AQ, in case you have children and you're thinking, are they autistic or not? If they have learned to read early and very, very well, that's called hyperlexia. And that might be something to say, yeah, this is more common in people with autism. And understand autism, they say spectrum, but we think spectrum as a line. The next thing I've heard is it's more like a color wheel. And honestly, to me, it's more like a globe because you can be autistic with these signs over here, over here, over here, over here, over here, over here, anywhere, and it still fits in that one globe of autism spectrum disorder. And I hate that name, right? Because it's not a disorder. It's just how our brains work. And I can tell you, it can be insulting to somebody if you say, well, everyone's a little autistic. No, nope, 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 nope. It's a very specific, many different things that can come to it, but not everybody. Our brains definitely work differently. If you are autistic, you can also have ADHD, dyslexia, dyspraxia, more likely, and your comorbidities are hypermobility, epilepsy, and gut problems. So a significantly smaller list than if you're ADHD. And realize autism is a huge spectrum. It can be anything from Rain Man to Einstein. How did I find out I was autistic? I was listening to a podcast that Hannah Gadsby, a comedian, was talking to Glennon Doyle, and she was talking about growing up and how she was autistic and all these things. And I kept saying, my brain works like that. My brain works like that. My brain works like that. And I went to my therapist and I said, I think I might be autistic. And she said, oh no. And then I told her why. And she's like, let's get you tested. Another thing, and Temple talks about this all the time, is if you say something and you look at someone's face and they're like, oh, shouldn't have said that, put it in the Rolodex, right? For those of you who are old enough to know what a Rolodex is. I put the picture in here in case you didn't. You have behaviors, whether it be verbal or physical behaviors, that you realize are not, I don't want to say socially acceptable, just different than maybe other people. And you have to think about things like, oh, I shouldn't say that, or I shouldn't do that. Other things that we do that help us recognize if autism is part of our being is masking and camouflaging. So if you go into a place and you look around and you see how everyone is dressed, how everyone's behaving, and then you behave like that, that is masking. That is not yourself. That's not being open and free. It is pretending to be neurotypical. And that can be exhausting. So if you go through work and you do everything great and people love you and you get home and you're like, oh, I can't get up, I can't cook dinner, I'm just exhausted. It may be that you're masking and camouflaging, right? Another thing is mirroring. So if you talk to, and this was so crazy for me, um, I didn't realize I did it. I do it all the time. I wasn't aware of it. If you talk to somebody like a client or a coworker, and if their mouth moves, right? They smile, they frown, their hands move, you mirror what they're doing, and you not, whether you do it consciously or unconsciously, that's mirroring. And why would people do that? Because honestly, when you look at the research, you connect, the person that you're talking to connects more with you. They feel you more. You're connected more when that happens. When I had somebody do that on purpose to me, it freaked me out. It was like someone was invading me. And I don't know if that's the same for everybody, but I understand that I did do mirroring, and it also can be very tiring. And if you have clients that you're working with, especially if you have somebody who is maybe not the nicest or in a comfortable, calm place, sometimes mirroring can help them connect with you and help them understand where you're coming from. So good, bad, and different. Inappropriate laughing and giggling. I used to have an office manager who would so frustrated with me because she'd come and say, Laurie, we have this problem, blah, 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 blah. And oh my God, are you kidding me? And I would laugh. She's like, how can you laugh at a time like this? And my thought process was, you can laugh, you can cry. I choose to laugh, and then I can be relaxed and they'll figure out how are we going to fix it. For her, it was totally inappropriate. You have repetitive behaviors. Everyone remembers Penny, Penny, Penny with our good friend Sheldon, right? Some people have to do things specific ways. For me, I have ritualistic tendencies. I have to clean. If I have a big project coming up, my kitchen has to be clean first. If I brush my teeth at night, I don't care what dessert you give me, I can't eat it because I brush my teeth. It just can't happen. It's just the way my brain works. Proprioception or lack of it, people who are autistic have more challenges. So doing things like martial arts and yoga can help us not trip and fall all the time or bump into people because we just don't have that proprioceptive awareness. Another thing that I found was very interesting is auditory processing disorder. For me, I don't watch TV. I can't watch TV. If there's a group of people talking and there's a TV on, I can't concentrate. If I'm at a concert or something like that, or even a party, and there's a lot of people talking, I can't concentrate on anything because there's so much, it's a cacophony in my brain. If that's you may think about, do I need to be tested for autism? Hyperfocus, that can be amazing, right? I learned all this stuff about neurodiversity because I hyperfocused on it. And other people might say, Laurie, you're a little obsessive. Yet it can be a blessing. I had the first rehab clinic, designed the first underwater treadmill, taught the certification course for 14 years. Why? Because I hyper focused on it and I learned everything I could to help people help animals. And you may say it's a curse because, Laurie, you don't have much of a life outside of work, but I love what I do, right? It's a blessing and a curse. Another thing is humor. So I can't tell you how many thousands of times somebody has said a joke and everyone in the room laughs and I'm ha ha ha, masking. I have no idea why people think that's funny. Yet, if you tell me a dad joke, I can't control myself. I giggle. I just love it. It's just the way my brain works. And subtle conversations, social cues, I might miss those. Somebody Some of my good friends will know to nudge me and say, yeah, nope, okay. Or I may lean over and say, why was that inappropriate? Or why was that funny? And they know that they can answer me. They can help me. Another thing, small talk. I can't stand it, right? I do it at work because we have to, right? Small talk is so important. And like people want to talk about something like sports. I would rather stick a fork in my eye. I can't. It's just not my thing. And it drives me crazy. Hannah Gatsby says, group of women get together and they start doing small talk. And she says, okay, you guys talk over there. I'm going to go rearrange the furniture, right? I need to do something. And that's not it. Yet we can mask and do it. And it helps us be socially acceptable. But if it drives you crazy, that may be a sign. We have a problem solver's brain. And it's not just males, right? I know people think, oh, the guys fix everything. You know what? Women can fix things too, right? If there's an issue, I want to fix it. I want to help. And we, autistic people, can have a very, very strong math and logic, right? Like the math Olympiads. Yet, I have horrible facial and name recognition. There's times where I've had somebody stay at my house for an internship for like a week or two. And like 3 years later, I turn and I see them and I have no clue who they are, right? My brain just doesn't have that function. Or I can have a friend that I've had for 10 years and I go to introduce him to somebody and I say, and this is gone, just nothing there, right? Now, with animals, it's a lot better, right? This is Fluffy, this is Susie, this is Johnny. People, not so much. Time blindness. I say that I have a unique relationship with time. I have no concept of it, right? I have to have alarms on my phone. I have to have my day set so I know exactly what I'm doing when, or time is just gone. I am frequently late to things, so I have to try to be things early so that I can get there on time. Challenge, right? Yes. And gift. I tell my clients, I will never promise to be on time. And I promise that when I am with you, you have 100% of my hyper-focused attention, and I will do everything I can to help your dog. Difficulty appreciating your own and others' emotions. Sometimes you just don't see when people are upset. Aversion to maintaining eye contact. I have very strong eye contact when I'm talking to somebody. And I think it's because I can remember when I was little, my dad shaking me and saying, look at me when I talk to you. Okay, now I can't look away, right? Just changes the brain. Interpreting things literally. I can't lie. I'm a horrible liar. I just can't do it, to the point of if I say something and just something is slightly off, I have to modify it so that it is absolutely true. It's crazy. It's the way my brain works. Sensory differences. Some people have heightened senses of smell. I have a very low sense of smell, which is great as a vet, right? I don't smell anal glands very much. I don't smell when the dogs are farting very much. For some people, it's like, oh my gosh, I can smell a fart a mile away, right? Other things like wind, like if there is a fan blowing, cannot blow on my skin. It makes me uncomfortable. White noise drives me crazy. Other people are like, oh, it's great. I go to sleep to it. No, shut it off so my brain can shut off. Sensory overload. I am really easygoing until I'm not. And then I'm snippy and short-tempered until I can do what I need to do to get back to being comfortable in my own skin. I call it recharging. You may see that with others. Anyone with neurodivergence may see things like we have changes in our brain, not good or bad, with memory, organization, emotional control, the ability to plan tasks. Right? We have these things that we can do. And if you're neurodiverse, when you get stressed, it goes out the window, right? I was in a car accident a couple of years ago. And if you say, Laurie, what happens if you're in a car accident? Oh, right. You stop, you pull over to the side, you get your driver's license, your insurance card, right? Blah, 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 blah. I was in that car accident. I had nothing. I didn't know what to do. My brain went blank. So when you're stressed and overwhelmed, that can happen. And it's okay. Once you know that's going to happen, you can you do your deep breathing, do the things that help you get right in your body so that you can be who you are and not shame yourself or get upset with yourself because you couldn't do what you needed to do in that case of emergency. It's okay. It's okay. And have the social friends, the people that support you, that can be there for you when you are overwhelmed or when you have that medical condition or whatever it is that brings stress to you. Let's talk about sensory overload for a minute. We need to understand this. This is super, super important because this is physiological. When we are stressed, we release cortisol, and that's a normal thing. There's a mountain lion over there. You need cortisol so you can run really fast and not get tired and freak out, right? It's okay. But if you do it all the time, your body gets drained. You have adrenal fatigue, and that leads to burnout. So let's back up and look at what that looks like. We can have cortisol release and have a meltdown. We're going to go through meltdown and shut down a little more in just a second. It may start out as being disassociated or snappy. Our responses are either fight, get in your face, right? Flight, I'm out of here. Freeze, oh my God, I can't do anything. Or fawn, I am so sorry. I'm so sorry. What could I do? Oh my God, what did I do? What can I do to fix this? All of those things come about when our cortisol is released high, leads to burnout. You may find that coping with new things is scary and brings about that same kind of anxiety or cortisol release. And once you get there, you're easily overwhelmed. And that's going to lead to meltdowns and shutdowns. And it can be something simple. It could be you're sitting at the park at a picnic outside and a silverfish crawls across your arm and you freak out because, oh my God, it's a bug. Oh my God, I hate the bug. I hate the bug. I hate the... A bug crawling on your skin? It didn't bite you. It's not a big deal. Yet that cortisol release can be crazy and it can take you time to calm down from that. Understanding that, and again, having your tools to be able to bring you into your own skin is so important. All right, let's talk about meltdown and shutdown. Meltdown is I am stressed and I am letting you know about it. I am melting down. I am going to act like a 2-year-old. Maybe not that bad. I'm going to maybe act out. I don't feel safe. I don't feel comfortable in my own skin. I'm going to behave in a way that I wouldn't want somebody to behave to me. And if it keeps going, you get to shut down. I'm numb. I don't care. I'm going to do what I want. I'm going to do this, 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 and this. Science. It literally, if the dorsal vagal nerve disconnects and we go numb, think about people that work in the emergency room and they can do this and this and this. I would be horrible there. I would just be bawling my eyes out. Couldn't do it. Some people can do it. And if it's stress related and you stay in that, it's not healthy for you, right? Meltdowns and shutdowns can be misidentified as panic attacks or PTSD. We want to not get to shutdown, not get to meltdown. When we get to that fight, flight, freeze, or fawn is when we want to say, hey, this happened. If I need that cortisol for a short time, it's okay. And then I need to do things so that I can have my full brain working well so I can do what I need to do, because what we need to do is help the animals. So somebody in your life or yourself is having a meltdown or shutdown. What do you do to help them? Don't come fast and say, what's going on? Are you okay? It's okay. It's okay. Worst thing you can do. Talk soft and slow and in a deep voice. Not high, because that turns your anxiety on. You can ask them if they need something, but realize that they may not know what they need. And if you can figure out what they need without even asking them, that's even better. Help them find a quiet place, right? Quiet, not a lot of lights, dim, maybe have some privacy so that if they're going to cry, it's okay and they're not being ashamed or feeling bad because so-and-so is seeing it. Don't touch, right? Loud noises, sudden movements, all of those things can make it worse. So just calm, and soft. Reduce sensory stimulation, right? It may be shutting off the music, be making sure that someone with heavy perfumes isn't around. Let them have quiet time. Give them time to recover. There is friends of mine who work at a restaurant, a high-end restaurant, and they have a word. And forgive me, I don't remember what the word is, but they run their butts off from the time they start their shift to the time they end their shift, because it is a high-end restaurant. And they have a word that if they are at this point, they come in the back, they say the word, and they go outside. And the rule is they have to be out there for at least 5 minutes. You're not allowed to come back in before 5 minutes. And everybody else in that kitchen will cover your tables, take care of everything that you need to take care of, because they know that they're going to be in the same place, and it works. So if you're in a hospital where you can implement this, it's a great thing to have. And realize when somebody is having a meltdown or a shutdown, you want to be kind, reassuring, not judgmental, right? That's huge. Don't put shame on that. And understand that neurotypical people have meltdowns too. I love this picture because this is me, the joy of missing out, right? Everybody's getting together. You know what? I'm going to take the day off. I am just going to sit and read or go for a hike, do something. I don't have to be involved in everything. My alone time is my time, and it's very precious to me. Values. Understand that people are neurodiverse, have a high tendency to be hard on themselves, and they work by their own internal metrics. A lot of times, for me specifically, fame, competition, material wealth, it doesn't impress me, right? I was asked by I lived in Chicago, a very famous basketball player, to come to his house and treat his dog. And I said, no. I said, I have my schedule filled for the next 3 weeks. If we want to do something after that, that's fine. We will schedule a time. But I have all of these people that I really care about, dogs who mean so much to me, and other commitments that are rock solid. And for me to drop that for someone, I don't care what you pay me. It's just not worth it. If you don't care enough about your pet to come to see me, then I will get to you when I can get to you. Another thing is I'm an introvert, right? And realize that whether I am myself or I am in an overwhelmed situation, I may look like I'm antisocial. I don't need to talk to people. I can just sit here and watch other people talk to people, and that's okay. I have a great group of friends. What I find with neurodiverse people is we find people that we connect with energetically, and that's what makes it so special. We have a special kind of kinship. Interesting, gender differences. Men who are on the spectrum are usually applauded. They're strong, they're smart, they're decisive, they're powerful. Stephen Jobs, Einstein, Bill Gates. Women are criticized. They're belligerent, unreasonable, malicious, controlling, aggressive, or dominant. And what we find is that these women, super smart, super strong women, get beat on, right? They have to work harder and smarter than the men in their field just to get recognized. And they can frequently have PTSD from all the small little nitpicky things that happen every single day. And I mean this with zero disrespect to surgeons. I have some friends who are amazing surgeons. And when I was growing up, there was this stereotype of the surgeons. They're brilliant and they don't have a great bedside manner, but you don't really have to talk to them. They're hard to work with. They're easily frustrated. They yell, they throw things, they get upset, they think they are superior, they have no empathy, but they're really good at what they do, right? They're workaholics. I know some surgeons who literally work 5 or 6 days, 16 hours a day, because it's what they do. It's how their brain works. That can either be autistic or ADHD. Realize these people have the same struggles as everybody else. We want to work with them. And again, not all surgeons are like this. Something I found really interesting, there's 2 types of empathy. It can be divided into affective, meaning you're feeling what someone else is feeling, and cognitive, I know what you're feeling. And neurotypical people are much more likely to have cognitive empathy. I know what you're feeling. And neurodiverse people are much more likely to have affective empathy, which means I feel what you're feeling, which means if you're going through a day where you're working with a lot of debilitated animals and you're feeling, or the parents are just distraught, you're feeling that, you're dealing with that emotional baggage as much as they are, and more because you've got multiple people you're dealing with. So we want to work with that so that that doesn't bring you down. Compassion fatigue, literally to the point of collapse, right? We love what we do. It's what fills our cup because it's amazing. And it's what drains our cup because it takes so much out of us to do a great job at the thing we love to do. I tell people my life is like a roller coaster. It's ups and downs and ups and downs. And sometimes I say, God, please, just let me get off for a little bit and wait in line, just so I can get caught up. Another interesting thing, again, you can tell I'm a science nerd. I love the research. Autistic people are hypersensitive to pain. And even just anticipating a painful stimuli drops significantly our ability to be empathetic. Crazy? But that's how our brain works. We don't know if it's a protection mechanism for the brain, but it's there in the research. So if you think you or someone you know or care about is autistic, there's a whole bunch of tests that you can see online and look for them. All right, so what's the most important thing? Peace and understanding, right? Be cognizant of people's feelings and emotions and what they're doing and how they're thinking, and that can help us get on the road to balance. If you are autistic, or even just try and see if this helps you get into yourself, something called stimming. For some people, it's tapping. For some people, it's dancing. For some people, it's flapping. For some people, it's bouncing. For some people, it's spinning or biking or running. For some people, it's rocking, right? You can rock. That helps you. One of the things I like is palm stimulation. It's crazy, and it helps me. Before I'm lecturing, if you were to look, you would see me doing this. It helps me be who I am and be calm and relaxed. And you can laugh at me. I have no problem with that. I had this on my car steering wheel because I'm doing house calls. So driving from place to place as I'm moving my hand, it's stimulating me to help me stay calm and be who I want to be. If we don't have an outlet, we shut down and destroy ourselves on the inside. And I don't want you to have that. Another great tool, I call it the pink elephant. I recommend having a stuffed animal in your clinic. It doesn't have to be a pink elephant. It can be anything you want, a penguin, a turtle, but have it be where everyone can see it, yet up and out of the way. Then when somebody who sees somebody struggling, take the pink elephant down and put it down where everyone can see it, but not in the way, so that everyone knows somebody in our midst is having a hard time. And we have to be extra compassionate, extra caring. We want to help them out. And then only the person who either was having that hard day or the person who took the elephant down can say, okay, we're back to normal. Take the elephant, put it back on the shelf. It's a nonverbal visual cue to help everybody be in the right place to have a strong team. Please don't be the, oh my God, she's being such a jerk, right? Or he is such a jerk, he did blah, 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 blah. That doesn't help anybody. Another thing for autistic people, we are more sensitive to blue light. So your phone, your computer screen, the TV, all that stuff, it affects melatonin, which disrupts our sleep. You always want to have good sleep. Don't fear the difference. Myth. Being neurodivergent equates to incompetence. That is not true. Truth. Neurodiversity offers fresh perspectives, innovative problem-solving techniques, and unconventional approaches to both human and animal care. So embrace the chaos and witness the magic. It's an amazing thing. We want to have an environment that has diverse minds. If everyone thinks the same, you're not going to progress. You need that diversity to help move forward. Encourage open communication, super important. And if you don't understand anything, things like, can you repeat that for me in a different way? I'm not sure I understood that. Let me say that back to you the way I think I heard it. Actively listen to people, not just be as I'm thinking about something else. Create space for neurodivergent people to work with you. Remember, as a team, we're only as strong as our weakest link. So if we break that link down, we're not helping the team. We're not helping the dogs or cats or horses or whatever you work with. By building that link up, we're strengthening the whole team. If you can, provide structures and strategies to help the challenges. Break things down into small, manageable tasks. If you have somebody who is OCD, give them something like the OSHA project. I can make sure everything is checked off. So give them something to help their strengths. Or if they're cleaning, right? This is what I need you to do. Here's a checklist. I need to see all the checks before you leave for the day. If they're a doctor, you need to write a SOAP plan. You need an S, an O, an A, a P on every record in the computer. You need to check every box so that we make sure this is happening. Visual aids and flexibility, right? When somebody says, I need a minute, give them 10. Don't say you have 1. Sensory sanctuaries. Not everyone has the ability to say, you know what, go outside or go to the lunchroom or go somewhere where you can just come back to yourself. But remember, when that person comes back to themselves, their brain is going to be working better, their heart's going to be working better, and it'll be a better part of the team. So if you can give them that, please do. Embrace the quirks with love. If you have neurodivergence, there are places on Facebook specifically for DVM moms and DVM moms with neurodivergent kids. That is, if you look up Julie Busby, she is one of my heroes. She's from Dr. Busby's Toe Grips. She's amazing. And she has 8 kids, multiple neurodivergent. She gets it. And there's Facebook groups that we can be surrounded by people who get us. Patience and empathy. Remember, I know I'm going on a lot about this, but it's so important. Kindness speaks louder than words. Don't judge. Have compassion. Extend patience and understanding. Have empathy, not so much that it tears you apart, but that you can help others feel better. The path to a more inclusive profession begins with recognizing and embracing neurodiversity because it's there. Lastly, there are organizations on autism. Some are National Autistic Society, Autistic Self-Advocacy Network, Autistic Women and Non-Binary Network, BNND, so Black people who suspect they're neurodivergent. The one that I would be very leery and careful with is Autism Speaks. What I understand is that there is no one on their board who is autistic, and their method of dealing with autistic people is to cure them with behavioral changes. There's a lot of people in the autism world who disagree strongly with what they do. So with that, I hope you have learned something. I hope you feel like you can identify people that may be more neurodiverse and be more compassionate and kind with them. And if you think you're neurodiverse, please get tested so that you can understand how your brain works and how to make it work to the fullest. I'm Dr. Laurie McCauley. I hope you learned something. I hope this was helpful for you. Have a wonderful, wonderful life.